we're starting to enter, or what I believe is the century of the brain, right? Like we have better understanding of neurobiology, better models, better hardware, better software, better data. And all this is sort of converging us into a point where, some of the problems that were intractable a few years ago are starting to be tractable.
Hi, everybody, and welcome to Season 2 of Neural Compass. I'm Mark Jacobstein, and I'm really excited today to have two terrific guests, Matias Serebrinsky and Greg Kubin, who are together the co-founders and general partners at PsyMed Ventures, and in addition, two of my favorite podcasters. They've been podcasting now with Business Trip for, I don't know, at least probably 3-4 years, and among other things, 5 years. Okay, so when I first was putting together Neural Compass, two of the people I went to for tips. They have had a great interest in both the mind and the brain for some time, which they pursue via both their venture firm as well as with the podcast that they run, and really excited to get into it today. So maybe the first thing I wanted to get into here is why work on PsyMed Ventures and on Business Trip? What brought the interest in sort of mind and brain together to the front for both of you? Your backgrounds, while interesting, don't necessarily speak to this. You aren't neurobiologists by training. So maybe Greg, if you'd like to start, why build the firm together?
Yeah. So before working on this, I was a founder of a software company, and I would say I rode the roller coaster of being a founder. I experienced the ups and downs of raising money, hiring people, firing people, pivoting, and I would say through that journey, I realized that I needed better mental health support for myself. I actually had not done therapy before, and I hadn't, say, gone through an introspective period of working within my own mind. And I decided to really embark on that at the tail end of that startup. So I worked with a therapist for the first time. I started working with a psychedelic therapist as well. I started mindfulness meditation practices and was really struck by the distinction between what I was experiencing and what was generally available in the existing healthcare system. And so that was one of the impetuses of starting PsyMed, which was realizing that there were better care models out there, starting with my own journey itself. It's worth noting that, within my own family system and friends, I also saw lots of people that were going through their own mental health journeys and realized that whether it was, conditions like ADHD or even on the neurodegenerative side, people who were experiencing Alzheimer's, Parkinson's, all these conditions, people were getting, I would say, treatments that were managing their symptoms, but not getting to the root cause and enabling them to really cure what they were experiencing. And so I observed that gap as well. And that seemed to be like a big problem area. And so I don't want to go too deep into like the rest of my story. I actually think it intertwines with Matias' story, because I actually met Matias when I was a founder. We were both in the same tech accelerator cohort. And he went on to found a company and had his own journey. And so I'll pass the mic to Matias to kind of tell the second part of the story.
Fantastic.
My story pretty much overlaps 100% with Greg in terms of what was the impetus for starting this, my own mental health journey, and also my family's sort of history, both with brain illness and mental illness. And so it's something that's just been like pervasive and present in my life for a long time. While I was at NVIDIA, I was doing sort of angel investments and very interested in the topic, donating money and time to nonprofits. And at some point, it almost was like living a Clark Kent and Superman life, where 9 to 5 was all about AI infrastructure. And then outside of that, I was spending so much of my time thinking about brain and mental health and trying to figure out how I can be of service and help. And one of the good things of being at NVIDIA is that I had this like front seat to what now it's a little bit more accepted, which is the intersection of neuroscience and AI, like computational neuroscience, computational biology in general. And I started to see this in 2018 when, pre-LLMs, as I say, before AI was cool for sure. And
you were just hanging out with the wrong people, Matias.
Absolutely, you're right. You and Lewis have been banging at this for a really long time.
Hard to believe there weren't a few people at NVIDIA in 2018 who didn't think AI was kind of cool.
Oh no, but AI was not NVIDIA was not a cool company. Let's put it that way. So that is the main difference, right? It wasn't. If someone would be, saying that they were working at NVIDIA, it didn't have this panache that some of the other Mag 7 companies have, like Apple, for example. Now that has completely changed, right? And so to wrap this up, what I saw at NVIDIA is that we're starting to enter, or what I believe is the century of the brain, right? Like we have better understanding of neurobiology, better models, better hardware, better software, better data. And all this is sort of converging us into a point where some of the problems that were intractable a few years ago are starting to be tractable. And that was a big reason for me to say, hey, this is a good way of spending all my time, not just my free time.
I love that answer. First of all, what's interesting to me is I'm yet to meet a single founder who works in brain or mental health who doesn't have their own journey, typically that they're willing to share with the public around challenges with mental health, often as a founder. I mean, I think that there's something about being a founder that dials up the stress, that makes any predilections you have towards anxiety and or depression, let alone serious mental illness, sort of come to the surface. And of course, people work on the problems that they want to solve. But it's interesting. I think it's more universal than that. I think it's almost every founder I know, whether or not they've chosen to work on brain or mental health, has gone through these journeys. And at least for Lewis and myself, as well as it sounds like for you two, it's also felt like one of the most important problems, right? Like if you check off the list of problems in the world that you want to solve, working on understanding our brain and the concomitant challenges that we have with sort of being human, and the mental health challenges that come along with that, it feels really core and really fundamental. I love, Matias, you call this the century of the brain. One of my theses that we're sort of moving towards, I'd like to think of as sort of fully computable biology. And we're not nearly there, but we're starting to see glimpses of it, right? Things from AlphaFold to understanding binding pockets to we have pieces and parts as we bring together omics and ML and more data. Some of the greatest mysteries of all, probably the CNS being the greatest mystery, feels like something that, maybe in our lifetimes we will really unpack. And so like yourselves, been really excited to be involved with that. But it's one thing to have a great, an interest in it. It's another whole other thing to take the leap. And as I understand it, and it's right there in the name PsyMed, a lot of the initial thesis was probably around psychedelics or neuroplastogens. And I'm curious, say more about that, Greg. You mentioned that, you'd had your own journey there. I'm guessing you felt like it was an area that was underinvested in and or there was lots of opportunity. Certainly your portfolio construction would sort of speak to that. But love to hear more about sort of specifically kind of the thesis vis-a-vis psychedelic medicine.
Sure. I would say that my own experience, and I'll speak on behalf of Matias, his experiences were definitely part of the conviction that we built, just knowing how transformative the medicines can be. So it's like both from personal experience and people who we know. At the same time, back in 2019, when we were kind of thinking through this opportunity, I would say, applied a playbook that a founder would, which is, let's call it customer development, where we would attend conferences and read research papers and just reach out to folks who were very early to translating the research and really moving it into the clinic. And that process was revelatory in the sense that it got us really excited about the caliber of founders that were entering the space. And before we started anything, we actually started our podcast. And that was our opportunity to create a platform to learn, to educate, and really also to reach out to experts that were doing the work and tell their stories. The very first episode of our podcast, I actually did a ketamine therapy. I did an intramuscular injection at a clinic, and then shared that experience, and then interviewed the founder of a company that was developing a therapy.
Joe Rogan and Elon Musk, like, hold my beer here. We're gonna.
Yeah,
we're
I mean, it was definitely jumping into the deep end.
Yeah,
And that was my first time experiencing that. And what I shared in that episode was it surfaced a lot of my subtle anxiety that I was feeling at the time. And so you get like a firsthand look at what that experience was like. And so, it was basically the combination of research, lived experience, speaking with some of the early, change makers and founders in the field that catalyzed us to ultimately start investing in companies. And our Fund Zero, as we call it, was a syndicate on AngelList. So basically raising capital on a company by company basis when we found founders that we felt really aligned to and felt like we're operating with integrity in the space. And so, yeah, that's kind of how we got our start. And we knew that we wanted to have let's call it a bigger playbook over time. And so for us, starting with psychedelics enabled us to start really narrow and focused, kind of similar again to how, startups operate, and then expand that playbook to other areas within brain health and mental health. And so what that has unfolded to become has been investing in areas ranging from neurotech and brain computer interfaces to the microbiome to AI and AI assisted therapies and really beyond. So yeah, I would say it's been a evolution, but we've been following our curiosity and instincts, and it feels like things are unfolding in a way that I would say give me actually a lot of optimism about how the standards of care are going to change in the next couple of years.
Amazing. And first of all, kudos. I love the scrappiness of the startup story. So we're gonna start a podcast basically for business development or PMF testing of the waters. See what's out there. Great excuse to meet the experts. Probably good advice for a variety of other potential founders that are out there exploring their sort of axes of curiosity. I also kudos for like sharing, the fact that willing to do this sort of psychedelics personally in the milieu of the podcast. And one of the things that I think is really interesting, is the sort of courage involved with being in the neuroplastogen / psychedelic space. I did a podcast with John Crystal, who's now the chair of psychiatry at Yale and a very famous researcher sort of in the history of developing neuroplastogens for the clinic, probably 2-3 months ago. And, he's a scientist all the way down. He's an MD. He's also, I believe he's an MD PhD. He's a very, very, very deep scientist. And he came at this starting 20 years ago with very strong sort of scientific basis and understanding of pathways and what would promote neuroplasticity and the reasons that would be important vis-a-vis mental illness. But at the time, psychedelics had a sort of a terrible reputation as a bunch of things that hippies did to go trip, and like they were illegal. And to the extent that there had been a lot of damage done with maybe the excesses of the Timothy Leary era, et cetera. And I give him enormous credit for being willing to follow sort of his path, especially, it's one thing now he's the chair of psychiatry at Yale, but at the time he was an early career researcher where lots of people probably looked askance and looked sideways. And I'm curious if you guys felt that at all as potential investors. I mean, you need to have credibility with LPs who are going to write you checks so that you can write checks. You need credibility with the entrepreneurs that you're going to work with. And I think, in 2025, it's now pretty well established the efficacy of the neuroplastogens. We have approved drugs. We have extensive pipelines. I don't think there's many people in the field who would argue that there isn't some utility, if not great utility, for neuroplastogens in the clinic. But even 5-6 years ago, I don't think it felt that way. And I think even today, I feel this myself with my desire to call them neuroplastogens and not psychedelics. I mean, if I'm being like really honest, it's like, I got to use the scientific word because I can't talk about psychedelics because then, I'm like a hippie weirdo. I'm curious if you guys felt like this was sort of an act of courage, or if it just felt like, no, this we're following the science, man, and this worked for me, and I know it can work for other people, and sort of what your perspective was on that.
Well, it's a little bit of all those things, right? Definitely there was some resistance, internal and external, around it, especially because when we were thinking about starting the fund, right, we had this problem in mind, which is brain and mental health. And then we saw psychedelics as, one of the amazing novel tools that we have to really make a dent in this huge challenge. And so even the idea of being recognized as a quote unquote psychedelic fund versus a fund that invests in mental and brain health and happens to see psychedelics as this like incredibly novel transformational tool within that. So it's a little bit of both. In hindsight, there's the Peter Thiel quote about you want to be contrarian and right, and but then eventually this contrarianism needs to be consensus for things to work out. And so
you want it to be consensus right around when all your companies are maybe raising their Series B.
That's exactly right. Yeah. So it's impossible to time those things, but at least like you got to have a conviction about something you're doing and an intuition that eventually more people will come around. And that's what happened, right? Like we just had a portfolio company a couple months ago, that was acquired by AbbVie. And it's a company working on this set of programs around psychedelics. Who would have thought 4 years ago that one of the top 5 pharma companies in the world would be acquiring a program around psilocybin? Very, very few people. So that's a little bit how we went about it. I think like even today, this is sort of a challenge. And because we sit in this world where on one side we're chatting with biotech investors, LPs, founders that have a more traditional sort of way of doing things. And at the same time, we're investing in psychedelics. And for us, it's a cohesive story. It's a story around things that are safe and effective, right?
It's about the mind and the brain and how to make people as happy and healthy as possible.
Yeah, but for other people, it still takes time to go around it. So yeah, Greg and I had a lot of conversations where we were sort of giving support to each other around the fact that what we're doing makes sense and people will eventually come around.
Yeah. First they call you crazy, et cetera. So I'm also curious. I make a lot of investments in deep tech and hard tech and tech biotech, et cetera, where ultimately, like, I'm not the expert. My stock joke I've had for years is between my wife and I we have an MD and a PhD, and the problem is she has both. And but it's not actually a joke. It's true, right? And working in deep tech and hard tech and tech bio and biotech, which is really where you guys live, requires, I think, a deeper scientific sophistication than to invest in, I don't know, vertical SaaS software, right? I mean, I've looked at all these things in my career and I know which ones are harder to analyze because there's another axis or two where somebody's got to know it all the way down. And so I'm curious for you guys, because you're obviously very, very sharp, but you aren't trained scientists per se, not of the PhD caliber, spent 25 years doing the work, et cetera, on the bench. How do you think about diligence and understanding sort of enough to make the kind of bets that you guys want to make?
The way that we look at this is a couple of things. One, there are many ways to be a successful GP of a fund, and there's not one path. And so I think that's first and foremost, right? Venture is one of these businesses where there's people who come from lots of different backgrounds. When you think about the type of stuff that we're investing in, I look at it as a jigsaw puzzle, right? You have to understand the science and the technology, but you also need to understand the clinical trials, but you also need to understand the payer reimbursement model, but you also need to understand the commercial market dynamics. There is no one person who is an expert in all of those domains. that I'm yet to meet that person. If you find
Right.
that person, get them on the podcast.
They don't exist.
Yes.
Yeah.
And so I think what we are really good at is synthesizing the information in each of those domains. In some instances, we have advisors and we have, venture partners and people that support us. So for instance, in neurotech, we have an advisor named Tim Gardner, who's a co-founder of Neuralink. And, when we want to really go deep on the DD of a brain-computer interface, he can give us expert opinion in the safety profile of the product development, of the roadmap. And so, I think that's part of our sort of secret sauce, if you will. But then the other thing I'll say is, like, you start working in an area and you do it, and you familiarize yourself over time with the subtleties and the dynamics, and you frankly hone your algorithm. So, we're approaching year 6 of doing this work, and I'll speak for myself, like the dots are starting to connect in a way that feels, great actually, where we're getting, faster and better at doing diligence. Last thing I'll say is, for a lot of investing, there's like the technical side, and then there's the people side. And I actually think that what we've learned working with a lot of founders that are PhDs, MDs, it's actually very refreshing to work with people like us that come at this space from a very different perspective, where, we've been entrepreneurs, but we're, storytellers, and we're ecosystem builders. And I think that actually gives us a really distinctive value add to the founders that we partner with.
Thanks, Rick. I love the jigsaw metaphor. Completely concur that, frankly, in any complex investment, there's no way to know all the things. And part of this is, I think the art in some ways is knowing what you don't know and having a great stable of experts you can call on for the sort of the known unknowns that you want to de-risk or understand the nature of the risk, et cetera. And the other piece, as you mentioned, so much of this boils down to people. So you have a core thesis, for example, when you started the firm, that psychedelics were going to, as a category, be really important in brain and mental health. And then it comes down to which of the many teams working on this. There's a lot of labs looking at stuff. Somebody who is a great scientist is not necessarily a great entrepreneur. But as an investor, part of this is figuring out, when you meet the rare person, but it's not a unicorn. They exist, who is both a great scientist and a terrific entrepreneur, who maybe doesn't understand reimbursement, but they know how to attract someone who does. That's when it makes sense. And of course, early stage stuff, you don't have to be right all the time either. You just have to be right enough. So another thing I found really interesting is watching sort of the firm evolve. So started with this initial thesis, specifically a lot of early investments in psychedelics. But as you mentioned, you've branched out into sort of more broadly in pharmaceuticals. So not just the psychedelics, but other areas, but also neurotech, BCIs, EEG wearables, et cetera. And talk to me about sort of what drove that, and maybe some of your real highlights, if you don't mind, from the portfolio, things that you found really interesting.
Yeah, it starts from going back to our mission, right? Which is to back entrepreneurs that are creating these frontier technologies in brain and mental health. And so the critical part there is frontier and what it means frontier. For us, it's mostly about technologies that are transformational and not incremental. That's sort of one way of summarizing it. And a lot of the times when we're thinking about both a company that could or could not be a good fit for us, and in general, when we're developing theses around a specific area, a lot of what we're thinking is, is this just like a Me Too sort of area? Is this incremental, or this is like really proposing a new paradigm in terms of how we think about brain and mental health? And then, once you start there, the answer could be pure software, right? Like Jimini. The answer could be a device. The answer could be a therapeutic. The answer could be sort of a platform. And so we're agnostic to all of those things. We like to say that we invest across the entire care continuum, from drug discovery to drug delivery to delivery of care, right? As long as it's proposing this like new paradigm for brain and mental health. That's pretty much like high level how we think about areas that we invest in. And the other reason for this is going back to this idea of being consensus or not being consensus. There's, as Greg said, many ways of being a good investor. But one thing that's like pretty much common across the board is that if you're just investing in the same things that everyone else is investing at the same time than everyone else is investing, you're playing a really, really hard game.
Tough game.
Yeah.
It's going to be priced in for sure. Yeah. Good non-consensus bets are the best one. So I'm curious. I love the broad thesis about mind and brain. One of the things that struck me, I think it was actually during the conversation with John Crystal, where thinking about like neuroplasticity vis-a-vis psychedelics and the ability to essentially rewire the brain. And I just had some conversations a couple of days earlier with a leading psychologist about sort of CBT and what you're doing is rechanneling various grooves, basically, learning to stop ruminating, learning to reframe, which is essentially getting your brain to sort of fire in a healthier way. And like many good ideas, I'm saying, why wasn't this obvious in retrospect? But a lot of these things can work together, right? So you can imagine drugs and or neurostim that are involved with sort of amping up neuroplasticity or changing sort of the physical landscape of the brain to allow for changes in the mind, as it were, that are enhanced by things like therapy. And of course, this makes sense. When people typically have psychedelic therapy, they don't just sort of take the meds. Often they take the meds and there's somebody who's sort of guiding them through that, providing therapy, et cetera. But one of the things I've been hoping to see is more therapies and more companies that are actively working at the intersection. And I noticed, in looking at your portfolio, that you had at least one that was sort of at the intersection of digital therapeutics and sort of behavioral work, and then drugs or neurostim. I'm trying to remember. I think it was it Remipe? Yeah. So I'm curious how you guys feel about that thesis, and then if you want to talk about Remipe and kind of the thesis there, I'm curious.
So Remipe is a company that offers digital therapeutic and overall digital sort of software tools for people with, a series of conditions. And it's almost like a module type company where you can plug in like multiple modules or a few, and each one of these sort of like tools has different effects, like lowering inflammation, promoting neuroplasticity, and so on. So that's what the company does. One of the main programs they have is pairing this digital therapeutics, so a software tool, with a traditional drug for Parkinson's. And, they're still in clinical trials, but the hypothesis they're trying to validate is that pairing these two things, it's better than just taking the drug by itself, right? We're very bullish on this. It's, a different modality in many ways. But one of the interesting things, if you study digital therapeutics, is that they have been around for a while, and they historically haven't been very successful, at least from a business perspective. And so Greg and I had been thinking about, okay, like what would it take to change the dynamics there? And what we realized is that the problem wasn't so much of a science problem. It was actually a business model problem, right? It's like, how do you actually get these therapeutics, these digital therapeutics, in the hands of the prescribers and patients, right? As Marcus, you well know, healthcare is a very, very complicated ecosystem, and you have multiple stakeholders, and you got to satisfy most of them. You cannot just choose to.
You need pull through from the clinicians. You need payers to agree that the data says that this works. You need an effective therapy is just the first step.
Yeah. So that was the key realization when we first met Remipe. I joked saying this feels like couch surfing and Airbnb, right? Where there's this sort of similar quality of the product, but there's a few things that change that make all the difference. And fast forward today, Remipe is doing extremely well. They have a few unannounced partnerships as well with very, very large players. And so that's a little bit how this company works. You pair a digital therapeutic with L-DOPA, which is a very traditional Parkinson's drug.
I love that. And actually, such an interesting non-consensus bet for you guys. But I think in some ways, again, easy in hindsight, the wonderful thing about that from a sort of investor perspective is L-DOPA is already de-risked, right? There's no, we're not worried about phase 1 data. Is it safe? We know it's safe. And actually working with already approved drugs, I'm involved with a different company in a different space called Tahoe Therapeutics, where again, one of the first things they did is they were looking at sort of omics and interactions with cells vis-a-vis various diseases, but they started with drugs that were already approved and trying to understand how those drugs could be effective in lots of other indications in other places, which takes most of the cost out of the equation for actually developing therapies. And I think is a really great business strategy. And then if that works, then you can think about this vis-a-vis other drugs and other modalities, et cetera. But it's a great tip of the spear. I know you guys are sort of on record talking about not just improving people who are struggling with mental health, so struggling with anxiety or depression or serious mental illness, but also thinking about flourishing, which I think it's not nearly enough attention, right? In part because the US healthcare system is not set up to make people healthy per se. It is set up to treat disease, and they aren't the same thing. And the economic incentives are largely aligned around treating disease. And I'm curious, if you guys want to say more about that as an investment thesis, and whether you found good examples of companies where you feel like you could invest who are pushing sort of human flourishing, specifically separate and apart. I realize they're related, but so maybe separate from like treating disease. And if so, kind of what economic models you think work in for those sorts of companies?
Yeah. So, when we think about just the, let's call it the continuum of well-being, right? You can start as being ill, you can get to baseline, and then you can thrive, you can flourish. And with, flourishing, the question is like, what form does that take? Is that feeling really good, or is it actually augmenting the brain's capacity? And so I would say that historically, most of the drugs and therapeutics that have been developed looking backwards have been more around treating illness and disease. And that's also partially due to the fact that, one, many diseases and illnesses have not had cures and are just, poorly managed. But then two, a lot of the let's call it ways to pay for these treatments have like CPT codes and are reimbursable. And so I think historically, we've just seen less research, frankly, around human augmentation, if you want to call it that, or flourishing. And the reality is there's so much opportunity there. And I think we're just starting to hit a corner. I think where you've seen the most activity is in the, let's call it longevity space, around treating certain disease states to support cells to become more resilient, but then that leads to, let's call it like more like longer lifespan, right? So right. That's where most of the focus has been in the last couple of years. But looking ahead, I think about neurotech, for instance, right? So you have a lot of treatments today that are, again, more on the mental illness side or treatment side that are like TMS for treating depression or for treating Alzheimer's. But what if we could create devices that could actually help with memory retrieval or storing, memory in the cloud, for instance? That's something that is potentially on the horizon. When it comes to sleep, right, we have lots of treatments that are for narcolepsy or sleep apnea or certain conditions. Well, what if we could optimize sleep such that you could sleep only a couple hours a night and actually be effective and efficient during the day? So we did a podcast episode on that theme. And I guess the list goes on. It could be around sight, it could be around hearing, it could be around emotional capacity. So I think ultimately our philosophy is that, I'll speak for myself. I don't fully accept what it means, what we historically have called as just being human. I think that we are, always evolving and changing. And I think with certain types of therapeutics and interventions, we actually may be able to continue that evolution of our capacity of our brain and body.
And
I love that. I enjoyed, by the way, I think you had, is it Ying Hui Fu from UCSF, correct, if I'm remembering correctly, who is like, I guess, the world leader on understanding the genetics of these short sleepers, as they call them, people who sleep. Everybody's got like one friend like this, right? They sleep 5 hours a night and they're like fine, and you're like, what's with? And I'm always a little pissed, right? Because like I would like that, but like maybe we can have it. I'm sorry, Matias, I cut you off.
Oh no, I'm sorry. So I was going to say, an example from a company perspective is a portfolio company actually called Neuroscience. And they have a device that helps with focus and attention. So the first, going from disease to flourishing, the first indication, the first market they're pursuing are people with ADHD. But the way I see it, in this world of AI, this kind of like new world that's coming, attention will be the most scarce resource, a lot more than capital. And there's an amazing book by Albert Wenger from Union Square Ventures that talks about this, right? And I'm fully bought into this. Like being mindful of our attention will be the most important quality that we can have as humans. And so it would be pretty nice if we have this device that helps all of us be more focused and keep our attention where we intended to be. So that's an example of a real company working in human augmentation, human flourishing.
Yeah, so attention is all you need, apparently. So, sorry, that'll be my last Transformer joke for the day. But I agree completely, and it's interesting because humans have been doing this for forever. I mean, we were joking right before the podcast started, as I'm drinking my coffee, that caffeine. My middle-aged Triple Crown is caffeine, creatine and protein. And actually, I do think interestingly in this sort of flourishing space, some of the first really successful companies have actually been sort of supplement businesses, right? Like arguably creatine and for that matter, caffeine are versions of this. They help drive attention. They help drive good short-term memory and performance. The challenge has been, I think, with supplements in particular, it's also a space, there's lots of hucksters and lots of stuff with no evidence that doesn't actually work or isn't high quality, but then there's also stuff that's terrific. It makes it, I think, actually very challenging for investors who want to sort of the wheat from the chaff. And some of these others, like the neurostim idea, I think is fascinating. And also this sort of enhancement of mindfulness piece, which relates, I think, to the earlier conversation of can you take ways we've known for centuries or actually millennia, like help shape the mind, like meditation, and maybe combine them with new technologies that open up the brain to exactly this sort of reprogramming and can it drive really positive change. My hope certainly is yes, and I love that you guys are playing in that space. Any favorite investments that like you didn't make? So where you love the tech and you loved like the potential outcome, but sadly you couldn't find conviction in the business because of some of the fracata, crosswise, misaligned incentives that we have in the U.S. healthcare system, and you're sort of hoping that someday that will change, and maybe you have one or two you don't want to reveal because there's some secret sauce there. Probably should have prepped you with this question in advance.
Well, I'll try to provide a good answer without sharing a specific company, but you were spot on where there's like many times that a founder is working on a very interesting problem and the technology makes sense and the business may or may not be the right one. But the reason that I actually fundamentally for the early stage that we invest in, don't believe that's a reason to pass. The reason why we passed on things that were amazing were because the founder wasn't, in our perspective, an A+ founder. So I think like a lesson learned in this is that even with this amazing technology, right, it takes so much. It's so hard to build a company that you need this A+ person to be leading it. And A+ means multiple things for different people, right? But it's got to be A+ for me in order to decide to partner with someone for the next 10 years.
I've learned that lesson again and again and again, where when you meet somebody, first of all, who is working on something really important and they've done important work, and often they're sort of very likable and enthusiastic, and a little part in the back of your head is telling you, but for all the different reasons that they may not actually be a great founder to drive a company to success that is probably not going to work, and it never does. It is that part is really hard. So thank you guys. The one, I guess, final question, Matias, I think you answered this earlier, but I'll have you repeat it. I always ask guests, any books, podcasts, TV shows, any content that you're consuming lately that you think is particularly interesting for people who are interested in brain, mind, neuroscience, AI, intersection thereof. Obviously, you have your own wonderful podcast, which we will, of course, promote heavily around the launch of this. But and you mentioned the book from the partner at Union Square Ventures. So if you don't mind, Matias, tell us that book again. And Greg, if you had any suggestions as well.
Yeah, the partner is Albert Wenger, and the book is I forgot the name, something about
life after capital.
Yeah,
like
something
the world after capital.
The world. Yeah, thank you, Greg. The world after capital. I would say that a book that actually was recommended to me by Ed Boyden, an amazing neuroscientist and just overall, spectacular scientist, is called Time, Lab, Memory. And it just follows the life of a very well-known neuroscientist. And it starts with his sort of obsession with fruit flies and how much that drove sort of the era of genetics and, understanding behavior. And there's an amazing quote in that book that I try to remember. Someone in the book says, when we don't understand something, we call it behavior. As soon as we start to understand it, it turns into metabolism. And I feel like it's a really, really interesting way of like really, focusing on understanding the brain, right? Like there's so much that today we think it's a mystery. It's just behavior. It's this emergent property. But we have a chance to like go a lot deeper and fundamentally understand where those things are coming from. And that will make all the difference for modulating the brain.
I love that. And interestingly, of course, now in the era of LLMs and the rise of a variety of AI reasoning techniques, et cetera, one of the relatedly, I think it's fascinating the way what we understand about the brain is making its way into how we think about building LLMs. Obviously, it started with being neural nets, of course, but similarly, actually, some of the things that we are learning about how you can pull memory and reasoning apart in LLMs, and some of the things they're learning about interpretability probably are going to read one way, shape, or form. And I don't want to over anthropomorphize it, but like on how we understand the brain, this will be a fun problem to look at for the next few years. And Greg, anything from you?
Well, I'll share. I just read the book Siddhartha, which I think is relevant in this context for two reasons. One, the quest, the hero's journey, and reinventing yourself and trying things that are different. To your earlier question about our first foray into getting involved in psychedelics. And so I think it's a powerful story about just finding your path and following it. And number two, one of Siddhartha's big insights in this story, and it takes place in the time of Buddha, is where he finds the most truth is within his own truth and his own experience. And I think there's an analogy to being a founder or investor where you just got to look inwards and follow that, inner compass. Worth a read if you haven't read it.
I have read it, but interestingly, I think it was probably 35 years ago. Mm-hmm. So it's probably time to dust it off. Hermann Hesse, right?
Hesse, yes.
Hermann Hesse, time to maybe dust that one off. So fantastic. Well, thank you both. This was so much fun. Really enjoyed the conversation today, guys.
Thank you, Mark.
Likewise. Thanks, Mark.